Well, the 9th South African AIDS Conference kicks off in Durban today. It's the second largest HIV conference in the world, attended by about 3,000 delegates. So we look forward to the start of this conference, and we invited Mark Heywood, a renowned anti-HIV activist, to get a sense of how far we've come. Mark, thank you very much indeed for your time. It is always an important gathering when you got role players and decision makers, in one place, trying to forge ahead and trying to find solutions to this pandemic. Let's talk about the progress, Mark, that has been made in South Africa over the last decade with regards to the fight against HIV and AIDS. How far have we come?
Good morning. Well, we have made huge strides in the fight against HIV and AIDS. You have to think back to 19 or 20 years ago with the very, very large numbers of people who were dying of AIDS, the fact that 20 years ago nobody had access to antiretroviral treatment, that there was a huge controversy over whether we should provide medicines to prevent mother-to-child HIV transmission. All of that seems as if it's a world ago, because today we have over 4.5 million people taking antiretroviral medicine on a daily basis. We have cut the rates of mother-to-child HIV infection dramatically. We have a president who is committed to HIV-controlled HIV eradication. So, it's proof that you can bring about a massive turnaround. But what I would say is that there is absolutely no grounds for complacency. A report that was released yesterday, for example, showed that last year there were still 270,000 new HIV infections just in 1 year. We are still the country with the highest rate of new infections in the world, with the highest burden of disease. So this conference is timely, and it's timely because we can never lose focus.
Yeah. Let's just talk about this reported global shortage of an active ingredient of ARVs offered to patients. I understand it's a second-line treatment. What's your understanding? What's your information with regards to this?
Well, first of all, it's true. There is a shortage. The Department of Health has admitted as much in a statement I think they released yesterday or the day before. It's a significant shortage, and it's one of those things that we have to monitor very carefully because, as I've said, millions of people are dependent upon health systems working to deliver them their medicines to clinics and hospitals throughout the country on a monthly and on a daily basis. We also have problems, which will be a focus of the conference, of stockouts of other antiretroviral medicines at our clinics. So, effective HIV management and control requires a strong and effective healthcare system. So this is a critical issue.
I want you to just explore this a bit further with regards to this particular ARV and the ingredient in it. And in terms of it's tackled and it's used by people who have more than one strain of HIV, correct?
Well, no, look, put simply is we describe HIV treatment, people go on to a standard, what we call first-line regimen. That is on which the regimen on which the vast majority of patients take the three drugs, the combination of three drugs. If people are unable to take that regimen for whatever reason, the drugs may cause side effects, then they're moved on to a second-line regimen. Eventually, if those don't work, they're moved on to a third-line regimen. But what we're talking about here is a medicine that is part of the second-line regimen. It is one of the drugs that, not a huge amount of, a significant number, but the vast majority of people are still on first-line regimens. So it's a serious concern, and we have to address it. And I believe that the Department of Health has recognized the problem and are doing everything that they can to work on it. But it's complex. I don't think there's ever been a situation in the history of the world, in the history of medicine, where so many people in so many countries are dependent on a set of essential medicines for their health and indeed for their lives. So it's a global challenge and not just a national challenge.
Mark, I want to talk about PrEP. How important is it to make PrEP more freely available? How widely is it used? We're talking about the pre-exposure prophylaxis. Is this drug, the use of drugs to prevent disease in people who have not yet been exposed to the disease-causing agent?
Well, the organizations that I am part of, the Treatment Action Campaign and Section 27, argue that pre-exposure prophylaxis should be made much more widely available than has been the case up to now. For your viewers, as you've partly explained, pre-exposure prophylaxis involves taking antiretroviral drug or drugs by HIV-negative people who may be in relationships which put them at a higher risk of HIV infection. It's an approach to HIV prevention that is recommended, that is proven, that is supported by the World Health Organization. Again, I think this is going to be one of the debates that takes place at the conference this week. But certainly, we feel that where there is a medicine of proven efficacy, then we should be doing much more to make sure that it gets to the people who need it. Particularly, as I've said a few minutes ago, where we still have very, very high rates of new HIV infections, 270,000 infections a year. We know where those infections are. We know who is at the highest risk. So we need to be focusing on the people who are at the greatest vulnerability in the districts where we know there's the highest rates of new infections. We have to treat this. We're waging a war. We've got to be fought. We've got to base ourselves on the evidence, and we've got to move where the epidemic moves.
Are you saying that we're not doing that fast enough, Mark?
Well, I worry that a lot of lip service is still paid by the President, Ramaphosa, by the Deputy President to HIV, but I don't think that we are maintaining the readiness, that we're keeping the people who live in this country on guard sufficiently against this epidemic. Although we've come a long way, the epidemic hasn't gone away. And if we relax our guard for a minute, if people stop taking their medicines, then very quickly we bounce back into a very dangerous space. So, whilst I'm supportive of the efforts that have been made by the Department of Health and the government, I honestly don't think it's enough, and I question whether there is sufficient political commitment, for example, to reducing the rates of new infections amongst young girls who are the highest risk group in our country.
Look, it's always important to hit these targets that have been set. In terms of the 90-90-90 targets, the aim was to diagnose 90% of all HIV-positive persons, provide antiretroviral treatment for 90% of those diagnosed, and then achieve viral suppression for 90% of those treated by 2020. Mark, from your information, are we on track?
No, we're not. Let's just take the 90% of people on treatment, on antiretroviral treatment. I'm not sure of the exact statistics. I hope the department will publish them this week. But let's say we have about 4.5 million people in the country now on treatment, 4.5 million people who live with HIV. The total numbers of people with HIV is in the region of 7.5 million. That's nowhere near 90%. Now, if you're nowhere near 90% with your coverage, it's obvious that you're nowhere near 90% with your viral suppression, which means, again, that it's a vicious circle, which means that people continue to be at risk of new HIV infection, which makes it difficult to reach your 90% target. So 90-90-90 is incredibly ambitious. It's right, but we're going to have to do more if we're serious about achieving it. We can't just pay lip service to these numbers. Yes, we buy into them without putting the resources and the programs in place to make sure that we can actually get there. And that has been an issue, for example, with what's known as the President's Emergency Fund for AIDS Relief, or PEPFAR, who said to our government, we're not getting people newly onto treatment fast enough. We have got to step it up. And that, again, goes back for me to this question of how strong, how clear are our public messages today, telling people, advising people to test for HIV, advising people of the benefits of starting treatment for HIV. I mean, you have to ask yourself, how much messaging do you see or hear on a daily basis? As I sit here now, I rarely see or hear messaging. It should be in your face all of the time, because this epidemic is still very much with us. It is still a cause of death. It's still a cause of illness. It's still a cause of misery. We have to be committed to breaking it completely.
And stigma, Mark, is still very much a concern in terms of the proportion of people living with HIV/AIDS but don't know their status. How is this being addressed, and how is stigma affecting this?
Well, I think that stigma is still a problem because there are still human rights violations associated with, HIV discrimination. Again, I ask you and I ask the viewers, ask yourselves, how many people do you know who live comfortably and openly with HIV infection? Very few people do, because they are fearful of responses of family, of friends, of colleagues in the workplace. If we can break the stigma, and we've been talking about this for a long time, if people stop being fearful about social responses to HIV, then they will stop being fearful about being diagnosed with HIV or going to a clinic to get treatment for HIV. I think there's also an element of self-stigma that we have to overcome as well, which is that people fear, they want to bring shame down on themselves, and that too has to be broken, because HIV is a virus that we are all vulnerable to. It's not something that should be the cause of people being ostracized or insulted or hurt or driven out of families or workplaces. So stigma is less than it was 20 years ago when Gugu Dlamini was murdered because she disclosed her HIV status, but it's by no means eradicated.
I mean, I get your point in terms of the messaging needs to be in your face. We're running a poll, Mark, on our social media platform and asking the question to our viewers, does HIV and AIDS stigma still persist in your community? And, as you rightfully say, it's reflected on this poll, 80% saying yes and 20% saying no. What about sexual activity at a young age, Mark? Is that a major concern? Do you think children should learn more about sex in schools rather than in areas like social media? Yes, because we know that children have sex, that children have sexual relationships. And we know that it starts at quite an early age. So I think that there's actually an obligation on all of us, and in the government in particular, to empower young boys and young girls to understand their own sex, their own gender, their own sexuality, to, in a non-patronizing way, to help people to understand their own risks of HIV infection, and also to convey these messages in a way that doesn't add to stigma. At school, for example, the school life orientation courses around HIV, around sex and around sexuality, you'll find a few schools where there are model programs, but I believe that in the vast majority of our schools, the programs are insufficient to tackle the risk that presents young people. Mark, we appreciate your perspective. No doubt we will be touching base with you during the course of the week to get your opinions on what's coming out of this all-important conference happening in Durban, the SA AIDS Conference. Mark Heywood, a renowned anti-HIV activist. Thank you very much indeed.